Hello, I'm Dr. Pamela Ruig. I hold the David J. Ellis Chair in Large Animal Clinical Sciences and Antimicrobial Resistance at Michigan State University. And today I'm continuing our series of antibiotic usage on dairy cows by addressing the important question of how do we make that decision about when a sick animal will actually benefit from antibiotic therapy. The first step in that process is to actually establish that the sick animal is affected with a treatable bacterial disease. And to start that decision-making process, we start by reviewing the previous treatment history of that animal to determine if that case is indeed a chronic case or it's a new case. We need to determine if it's chronic because repeated treatments are rarely effective. If the initial treatment has actually failed, rather than just repeating an antibiotic or randomly changing, make sure you work with your local vet to decide on the next steps. And that next step may not be an antibiotic treatment. The second way we establish that a sick animal is affected with a treatable bacterial disease is to make sure we indeed have done the right test to confirm that bacteria are the cause. Those tests may include cultures of tissue or milk, results of necropsy exams of other animals that have been affected, or other tests to rule out non-bacterial causes of disease such as viruses. But before we give an antibiotic, we often need to perform some tests. The third step is to make sure that we recognize that the clinical signs that we see in affected animals are often the same for diseases caused by bacteria as well as diseases caused by other agents such as viruses. One great example of this is calf diarrhea. Calf diarrhea can indeed be caused by bacteria such as Salmonella and E. coli, but in many instances it may be caused by viruses such as rotavirus or coronavirus, or could be caused by parasites such as Cryptosporidia or Coccidia. In fact, on many dairy farms, most calves affected with diarrhea don't require antibiotics. The most important parts of the treatment protocol are actually maintaining the hydration and electrolyte status. So make sure you work with your local veterinarian to have a diagnosis of a bacterial disease before giving an antibiotic. Now, even more confusingly, sometimes we have an actual bacterial disease, but the cow's immune system is completely or mostly effective at eliminating that infection. And antibiotics aren't required because we have a high rate of spontaneous cure. Non-severe clinical mastitis in adult dairy cows is a great example of that. On many North American dairy farms, only about 25 to 30 out of every 100 cases of non-severe clinical mastitis are caused by bacteria that actually will require antibiotics to recover. If you're interested in more information on this subject, we have many other videos on this channel that review pathogen-specific mastitis and treatment protocols and principles for non-severe mastitis. Now, once we've established we have a bacterial infection, we want to make sure we review all the options that we have available. And the first thing we have to ask ourselves is, can we maintain the welfare and productivity of the sick animal without the use of antibiotics? And sometimes the answer is no. For example, if we have animals that have been diagnosed with bacterial pneumonia, either cows or calves, their long-term prognosis without antibiotic therapy is very poor. The spontaneous cure rate is low, and we often see poor welfare and productivity in these animals if they don't receive appropriate antibiotic therapy. So we want to make sure that we give antibiotics to animals that do require them. We also have to think about what are our future plans for this animal. If the animal isn't going to remain in the herd for a long time, or if the animal has a localized chronic bacterial disease, such as subclinical mastitis caused by Staph aureus, or a mild infectious foot problem that has greatly reduced the productivity of the animal, you might want to consider if the animal is healthy enough for another purpose, such as being sent for beef. Finally, before making an antibiotic treatment decision, we have to consider if we've got an antibiotic available that's likely to be effective against the bacteria that we've diagnosed. And to do that, we have to be familiar with the approved antibiotics and review the label indications for those antibiotics. And we'll be discussing how to read labels and make that decision in future videos. So let's recap. Let's always remember that clinical signs of disease are not usually specific to bacterial diagnoses. And before using an antibiotic, we always need to work with the local veterinarian to establish a bacterial diagnosis, often using some sort of testing to confirm that diagnosis. We want to remember as well that antibiotics aren't always needed. For example, they're not useful for non-bacterial diseases such as most cases of calf diarrhea, nor bacterial diseases with high rates of spontaneous cure, such as most cases of non-severe clinical mastitis. And finally, before giving an antibiotic, make sure you review the history of the animal, consider other options, and always focus on maintaining animal well-being.